Okay, so we have a 63-year-old male who is experiencing constant pain in his knees. He talks about how he is not able to do meaningful things that he likes to do, such as playing with his grandchildren and planting in his garden. He was diagnosed with osteoarthritis, and for years he tried to cope with his pain and his disorder by going to physical therapy, visiting a chiropractor, and a nutritionist for better eating habits. He was recommended by his orthopedic surgeon to receive a arthroplasty to replace his damaged joints. After that suggestion, he was suggested to visit an occupational therapist, and the condition was confirmed by an MRI and x-rays. In the years prior to seeing an occupational therapist, he visited a chiropractor, 2 physical therapists, a nutritionist, rheumatologist, surgeon, x-ray tech, MRI tech, primary care MD. In the months prior to his surgery, he visited his orthopedic surgeon, his medical assistant, registered nurses on staff, and surgery coordinator and x-ray tech. In the days leading up to this surgery, a nurse pre-op appointment, pre-op from front desk staff. The day of his surgery, pre-surgery, registered nurses on staff, a surgeon, anesthesiologist, general MD, his orthopedic surgeon. His care team post-surgery was recovery nurse, general MD, physical therapist after 5 weeks, physical therapist directly after surgery, occupational therapist in the hospital and after 5 weeks, trainer in the hospital after 5 weeks for exercise routines, rehabilitation team, a substitute or on-call orthopedic surgeon, his regular orthopedic surgeon, his PA, and his office staff. Summary of the events was a 63-year-old male scheduled to undergo arthroplasty in his knees to replace his damaged joints. Before his surgery, the orthopedic surgeon stated that he would be making rounds to check back on him. Going to the surgery, he had a wristband that said that he had a latex allergy. After the surgery, the orthopedic surgeon confessed that there were slight complications in his surgery due to the latex in the catheter, and he developed itchy hives, dermatitis, and complications of breathing. The patient was experiencing hypoventilation, and during his inpatient stay, there was no complications with the intravenous therapy. And he stayed in the hospital for, he had no problems with his intravenous therapy and his intravenous therapy that was placed subcutaneously and removed on the 3rd day. He stayed in the hospital for 3 days, and when he returned home, he started to experience RIA, due to improper cleaning, and after a few days he was able to take acetylsalicylic acid to help with his pain. The patient was very upset. He was not okay with how the communication was going on. He said that they could have done better with the communication because they did not give him clear instructions on how to properly clean his stitches that was done, and he also had problems. He felt like they should have communicated and paid more attention to his allergy to the latex, and he was very unhappy with the overall communication process. And that's it.